But we must see that the struggle today is much more difficult. It's more difficult today because we are struggling now for genuine equality.
Hello and welcome to this new podcast of the American Journal of Public Health. We are today here in Minneapolis at the annual of the American Public Health Association with my good friend and co-host Vickie Mays. And we've looked at the program and we've identified several presentation, roundtables, that were really interesting and different from what we usually show you. So our first guests today are Adrienne, Ghorashi and Ruqaiijah Yearby. And you had a roundtable on the topic examining the role of state constitutions in racism, governance, and health equity. And we were really interested by knowing what's behind that. So please tell us what was the project and what you did and why is it important. But before that, just introduce yourself for our listeners.
Sure. Thank you so much for having us. I'm Adrienne Ghorashi, she, her. I'm a lawyer at the Center for Public Health Law Research at Temple University.
And I am Ruqaiijah Yearby, the inaugural Kara J. Trott Professor in Health Law at The Ohio State University, and I have a JD and an MPH.
Our project uses legal epidemiology methods, and the goal is sort of to examine the text of state constitutions in every state to look at whether there's an impact on racial equity. And so in this project, we're using our methods to focus on sort of a few key areas such as state governance and local authority, voting rights, and also sort of just the treatment, whether explicit or implicit, of race.
And one of the reasons we did that, because so many states are now passing anti-DEI bills, but on the other hand, localities have also declared racism as a public health crisis. So we wanted to see where the protections enshrined in the state constitutions around structural racism, around racial discrimination.
I think we need a little bit of background because maybe not everybody knows that every state has a different constitutions and what is this constitution about and what is it different from the federal constitution. Are we 50 times we the people or what's the...
Well, so that's what we're trying to figure out with this project. I'm not really aware of any other projects that have sort of examined the text of state constitutions like this before. And so we plan on using legal epi to turn the text of the law into data that we can then compare to public health outcomes and social determinants of health. Yeah, one of our missions is to see what actually do these state constitutions address or not.
And what's interesting, what we're already seeing is, of course, references to the federal constitution, but very different treatment of some issues around heredity. Most of the constitutions we've seen, the few, have included laws about anti-slavery, with the exception for criminal justice, just like in the federal constitution. But there are differences. So we hope in our project we can highlight those differences.
Let me just ask a question here, because this, of course, was one of the things I was just fascinated about, your roundtable. The constitutions, are these written like a long time ago? So what we're dealing with are things that may be in conflict with what we're doing. So I know in the state of California, we revisited our constitution and made sure that abortion was protected, or I should say reproductive justice took place. So do you have to worry about like things like the language and, kind of these old concepts that we really don't operate on, but if you go to court, you have the Constitution to protect those very old concepts.
Yeah, I'm actually so glad you raised that, because the other thing about our project is that we're looking at the changes over a 20-year period. And so we're looking at sort of the historical changes and amendments for 20 years. And so in some cases, yes, you can see that states have perhaps made an effort to protect abortion or to use more inclusive language. And then in other states' constitutions, you're like, how is that still in there to this day? It's embarrassing. So part of that is trying to look at a longer view.
And we chose those dates because we are actually starting around the enactment of Prop 209 in California, where they adopted the language around preferential treatment, which if you did not know your history, you would think that was an anti-discrimination bill. And so we are trying to look at that point where we start to see some state constitutions enshrining sort of discriminatory policies in the frame of anti-discriminatory language, and then go through now where we see the history of racism as a declaration of many localities saying, no, we're committed to racial justice, and then the rollback of the anti-DEI bills.
We're going to get near the end, so I want to make sure I can do two questions here. One is legal epidemiology. I think this is my first time really hearing about that. So for those who are listening and watching, can you talk a little bit about that? Because that might be an intriguing career. And then my last one is, what is the implications of the work you're doing for communities? Is this something that they can be the movers of the changes you want to see, or there are ways in which you hear from them what the changes are they're interested in?
Yeah, sure. I can take the legal epi question.
Okay.
This is a shout out to my boss, Scott Burris.
Oh my God, I know his work. So yes.
So this is a method that we use essentially to measure the law and turn it into data as a way to look at public health outcomes. And so for our project specifically, again, we are applying a set of coding questions to the text of each state's constitutions to be able to compare across these different buckets of voting rights, governance, those types of things. So it's like an objective measure of what is actually written in these. And then from there, once the policy data is completed, we're handing it over to Ruqaiijah's team to perform the analysis.
Right, and we'll add some discussion of some historical background, but also trying to connect it with some health outcomes in terms of life expectancy and other areas. And let me just briefly answer your last question, which is this something community can get involved with? Definitely, right? To be able to enshrine more protections against discrimination, we have to know what is in the Constitution. And this project sort of grew out of the work of my team with Crystal Lewis, Rashad Steve Backner, Shanita Steely Jefferson, Kimba Noel London, Debbie Chase, and our work with community around housing, and to really begin to try to give the power back to the community to ensure that their rights are protected, either by constitutional amendments or by trying to really enshrine the declarations of racism as a public health into law so that there is sustainable change.
I find this fascinating, this project, and maybe you'll think to AJPH when you get your data, but tell us, what are we talked about reproductive rights, DEI, what are the other main public health issues that your project is going to address?
Yeah, I would say, thankfully, I actually just published an editorial in the American Journal of Public Health called The Return of Jim Crow. And so what I think this does is that we tend to just look at legislation that is passed and not really looking at the constitutional frame that is a foundation for what legislatures and attorney generals are able to do. And so my hope is that this will be a foundation for individuals who are interested in structural racism to be able to see what the Constitution says and to build off of that, right, through either policy change or through litigation to ensure everybody has equal rights.
The return of the Jim Crow, that was a great expression. I couldn't keep it on the cover because I'm not sure everybody understands it. But what you mean is that the discriminatory laws that existed against African Americans at the beginning of the 20th century now are being extended to other communities, LGBTQ. How is your project, what is your project going to tell us about how a constitution deal with immigrant and undocumented people?
Yeah, I love that question because part of what we're looking at is how racial groups are defined, or if they are defined. For example, a lot of constitutions broadly reference the people. Well, we want to know who is included in the people. Is that actually defined anywhere? And the other sort of question we're looking at is around language. And so, some states' constitutions declare English as the official language of the state. So that's another sort of angle that we're interested in as well.
Sounds like we have some public health champions that we've talked to today.
Absolutely. And what are the names of the champions of public health that we have today? Ruqaiijah and Adrienne. So thank you so much, Ruqaiijah and Adrienne, for your contribution. This is a fascinating project. Really, we can't wait to see the result.
Thank you.
Thank you, everybody, for listening. Thank you for being there.
Bye-bye from Minneapolis.
Bye-bye.
Thank you.
Thank you.
And it's much easier to integrate a lunch counter than it is to guarantee a livable income and a good, solid job. It's much easier to guarantee the right to vote than it is to guarantee the right to live in sanitary, decent housing conditions. It is much easier to integrate a public park than it is to make genuine, quality, integrated education a reality. And so today we are struggling for something which says we demand genuine equality.